Hello guys, in this video we want to talk about high blood pressure from prevention to treatment. Stay with us. High blood pressure treatment methods. High blood pressure is one of the most common diseases in the world. This disease starts silently. This means that he may not have any symptoms even for several years. But even at this stage, it can cause many side effects in the body. Today, about half of adults, especially the elderly, struggle with this disease. For this reason, familiarity with the symptoms, side effects, and ways of controlling and treating it seems essential for everyone, especially the affected people and their surrounding people. If you or one of your family members is one of the people who have suffered from high blood pressure for some time, we suggest you stay with us. Effective factors in increasing blood pressure. Unfortunately, it is not possible to define a specific and single reason for people to suffer from chronic high blood pressure disease. In general, this disease can be divided into two primary and secondary categories. Secondary hypertension, as the name suggests, has a primary cause. But identifying this cause is not so easy and it may be revealed after years. Congenital diseases, kidney failure, cardiovascular problems, tumors and thyroid problems are among these causes. In such a case, the primary cause must be identified and treated first. And the other type is the primary blood pressure that occurs without any specific cause and over time and under the influence of various factors. There is a possibility that the occurrence of this problem is related to genes, environment or physical changes of the person. Also, some of the factors that can be involved in the occurrence and aggravation of this disease are stress, lack of movement, heavyweight alcohol consumption, smoking and drug use, improper diet. Symptoms of high blood pressure. Blood always flows in our veins. The flowing blood exerts a pressure on the walls of the vessels, and this pressure is actually the blood pressure, which is different in different places. But in general and according to different conditions, a normal range is defined for high blood pressure and low blood pressure, systolic pressure and diastolic pressure, of the normal person. If the sphygmomanometer shows numbers beyond this range, it is said that the person has high blood pressure or hypertension. As mentioned, this condition may be asymptomatic in some people. But with the passage of time and the progress of the disease, a person will experience different symptoms. Among the most important of these signs, the following can be mentioned. Severe headache, dizziness, flushing or flushing of the face, shortness of breath, nosebleeds, feeling exhausted, getting angry, occurrence of vision problems, pain in the chest area, seeing blood in the urine. A person who has several of these symptoms needs immediate medical attention and appropriate measures to reduce blood pressure immediately. But we remind you that sometimes this disease may be completely asymptomatic. So, if you feel that your blood pressure or those around you are high, do not wait for the next symptoms to appear. The best way to be sure is to measure the pressure, which should be done regularly. Complications of high blood pressure. If hypertension is ignored and not treated or controlled in time, it can cause irreparable consequences in a person. This problem can easily affect all parts of the body and disrupt their functioning. In the following, we describe 4 of the most important complications of high blood pressure. (1) Cardiovascular diseases. The first and most important part that is related to the blood vessels and blood pressure in them is the human heart. Damage to the heart and the occurrence of cardiovascular problems, including damage to the arteries, coronary artery disease, heart failure, and left heart enlargement is one of the most dangerous complications that may be caused by high blood pressure. Such complications in more advanced cases cause heart attacks and even sudden death. 2. Damage to the brain. Blood supply to the brain is of great importance, and the occurrence of any problem in the arteries leading to this part of the body can affect the functioning of the brain. Dementia and stroke are other complications that occur if high blood pressure is not controlled. 3. Causing kidney dysfunction. The effect of high blood pressure on the kidneys. Kidneys are another vulnerable organ due to high blood pressure. High blood pressure and damaged vessels can lead to various kidney diseases such as kidney ulcers and kidney failure. 4. Damage to the eyes. The effect of high blood pressure on the eyes. Very delicate and sensitive vessels that are responsible for supplying blood to the eyes are vulnerable to high blood pressure. If they are damaged, a person may have retinal damage, optic neuropathy, or fluid accumulation under the retina. The way to reduce high blood pressure immediately. Carrying out the correct actions, or in other words, Having the best reaction when blood pressure increases is one of the most important steps to prevent the occurrence of dangerous complications of this disease. One of the effective measures to reduce blood pressure immediately is massaging the shoulders and neck. Try to massage these parts gently and encourage the patient to remain calm. You can also immediately give a sublingual tablet to the patient. But if you don't have pills, you can use pickles such as apple vinegar, water, lemon juice, orange juice, etc. for immediate and emergency treatment. In addition to these things, garlic is one of the substances that can quickly reduce blood pressure. You can prepare some garlic syrup and give it to the patient. Pills to reduce high blood pressure. Some of the drugs that are used to treat this disease are as follows. 1. Beta blockers, which are responsible for blocking blood pressure-raising hormones in the body and also cause blood to be pumped from the heart with less pressure. 2. Diuretics that reduce blood pressure by excreting excess sodium from the body through urine. 3. Alpha-2 agonists that cause relaxation of blood vessels and as a result lower blood pressure. 4. Calcium channel blockers which, in addition to relaxing the blood vessels, cause a decrease in calcium entering the heart muscle cells and lead to a decrease in blood pressure. What to eat to control high blood pressure? Healthy nutrition for people with high blood pressure. Since the foods we eat have a direct effect on the functioning of the body, including our blood pressure, it can be said that one of the most effective ways to treat and control high blood pressure is to follow a healthy diet. For this purpose, in the first step, identify the foods that can reduce your pressure. For example, consume less sodium. Sodium greatly increases your blood pressure. Limit salty restaurant foods, canned foods, and homemade foods. Also, minimize the consumption of sweets. Sweets are another food that increases blood pressure. Include fruits and vegetables in your diet as much as you can. This group of foods, in addition to the various other benefits they have for the body, due to their high fiber content and lack of saturated fat, can reduce the amount of sodium and thus lower your blood pressure. Avoid eating high-fat foods, especially those containing fatty acids. High blood pressure treatment methods in general. According to the generally stated methods of treating high blood pressure, this silent killer can be divided into two general categories: home treatments and drug treatment. Here are some important steps you can take in this regard. Eat a healthy diet. If you are overweight, think about treatment quickly. Give up laziness and inactivity and exercise regularly. Keep calm and avoid stressful factors. Avoid taking drugs and alcohol separately. Take care of your health and do your checkups regularly. Take your medications on time. If you like this video, please like and subscribe and be sure to watch the videos suggested on this page.